is a really interesting question to be looking at in 2025 from my perspective. The question is Medicare Part A enough for hospital coverage? Today, we would say no, but if we were asking that question in 1950, people would be going, oh my gosh, that's wonderful that Medicare Part A covers 80% of hospitalization, because it wasn't that long ago, honestly, that, men weren't on the moon and there was no such thing as Medicare. People had to pay and people went bankrupt. People still go bankrupt for different reasons, but we have Medicare Part A, which is free. For many people, that's what they have to have. If they have Medicaid, if they're low income and they can't afford a supplemental policy, well then Medicaid pays the balance. So yes, it can actually be enough, but that's not all people and that's not all time. So generally speaking, no, we need a supplemental policy because 20% of an unknown number can potentially be extremely high. So for example, going to a doctor's office, 20% copay could only be, $40. Going to a hospital for a 20% coinsurance would, on $1 million could be $200,000 or more. So it's a necessary thing. So we need to look at it, find a way to affordably make that happen for everyone. But thank goodness we have Medicare Part A that's free. We are so blessed.